The chance now to put some questions to either the Cabinet Secretary or Joss or Frans. Have we got any questions in the room? Again, just wait till the microphone gets to you if you can identify yourself and then ask a question.
It's Paul Burns, NHS 24. It's a question for John Swinney, Cabinet Secretary. You mentioned there you'd like to challenge the organisational boundaries. How far would you go in terms of that?
Well, Paul, I suppose I get myself into trouble, Paul, at these events by just kind of giving people the invitation to think as broadly and as comprehensively as possible. I think, I frankly think that the opportunities are aplenty. If you take the preventative agenda to its logical conclusion, things that we might do in the identification of difficult circumstances in which a child lives in or is born into their very first days in life might actually be able to tell us who will be ending up in the prison population 20 years later with enormous cost to the public purse and a very unproductive outcome for the individual who is in that situation and for any of their victims that will have been caught up on the way. So, some of these, now trying to plot all that together, Paul, trying to work together all the connections that might work to enable that to happen is a complex process, but I'm convinced enough by the research that I've seen that many of those seeds exist much, much earlier than the problems crystallise in later life. But that requires public servants to be working really very openly and broadly together to identify how that can be undertaken. I think given the financial pressures that we're under, people saying, well, look, I really don't have any need to kind of look beyond the confines of my space, because as long as I keep this area ticking over fine, everything will be okay. But not recognising that just adjacent to the boundaries of that individual or organisation might be the seeds of a disaster about to grow up. It really isn't, it's just not good enough, Paul. And we've spent, I think, too many years as a country picking up the pieces and not trying to plan for better outcomes. That what we tried to do in 2011, and I have to say I see a very positive response to this across the public service in Scotland, is to say to the public service that let's change our way of thinking. I know it can't be done overnight, away from picking up the pieces to trying to avoid the pieces crashing down in front of us in the future. And that involves people thinking much more freely and discussing openly with public sector partners how that can be done.
But surely with the case that you've just illustrated, you're dealing in probabilities. The last thing they can be is open. Something like that would have to be held very, very close to somebody's chest. You cannot go discussing publicly the probability that somebody might go to the bad in 18 years' time.
No, but what you're doing then is you're identifying some of the ingredients of disaster in the early years of a child's life, and you're intervening there to try to give that child a better start in life. And the signs are, I think, well, there's enough research to indicate the signs are pretty obvious what that will be, and many of our programmes, many of our interventions, much of what is taken forward practically by public servants at a local level is about trying to interrogate some of those dynamics and to intervene in a constructive way. Now, clearly, no public servant will be going around saying, this child is 6 months old and I think the way things are developing, he's heading towards being an offender at 18. But we can see the difficulties and the challenging circumstances in which a young person will be starting their life. Equally, at the other end of the spectrum, there will be examples where I saw a presentation at the Turing Festival last summer, where a couple of technologists were showing how they could use vast amounts of big data to narrow down who was more likely to require rehousing because of age and infirmity compared to the next person, to do with housing styles, structures, income, health records, all these kind of things. Now, all that information exists, but exists in, I'll offend the technologists in the room by saying one dollop over here, another dollop there, another dollop there. If we don't connect those dollops, we're never going to work out how to intervene proactively to identify who would perhaps need to be the recipient of a more focused intervention to say, look, I think the time has come for you to think about moving house, as opposed to keeping on trying to get up and down stairs in a house that's just, just waiting to be the source of disaster.
Josh?
I strongly agree with that. John's absolutely right. And I think even more, the priority around IT investment should be driven by improved public service outcomes. We do, as you rightly point out, have massive amounts of data, which we make relatively little use of, in my view, both within our organisations and between organisations. But the point that I was trying to get across when I was talking earlier on is the importance of a collaborative infrastructure that allows different teams of professionals to work together for earlier intervention, and particularly around areas such as health and social care, where the separation just makes no sense at all, and it has got to be dealt with. And one of the ways I think we can do that is by sharing some of the IT infrastructure, which ironically will ensure that we do protect data perhaps rather better than we have in the past, because the way we pass it between organisations at the moment with disparate infrastructures is not always, in my view, as secure as it should be.
Have you come across this in Holland, Frans?
Yeah, definitely. The biggest problem we had when we were throwing the open data of public transport on the street, there were 5 people who went to court to prevent that. And who were those 5 people? The own employees of the public transportation company, because they saw their job becoming obsolete. So we didn't put that in the public. We talked to these guys and we basically said, okay, you're not gonna be fired, but you're still going to be paid by the public transportation company, but you will be a consultant to all these people who would like to build apps for who use this public transport open data. So that was another way of finding a solution to have the information across the city and to work cross-sectoral and cross-departmental. Another thing we did is the structure vision of Amsterdam, which is for 2040. We interviewed about 8,000 people, and that doesn't cost a lot of money. You just take community halls and you give them coffee and tea, and you talk to people for about 2 to 3 to 4 hours. And then I'm coming back to the point that John makes, is that we let the local people interview the local civil servants, talk to the local people, but also with the minorities living in Amsterdam. Minorities talk to the other minorities. The best session we had, and I've only been told this, was a session with the homeless people. We got a bunch of homeless people in a room and we asked, how do you see your city in 2040, and what, as a homeless person, do you need from a city? And we couldn't think of this, but the homeless people said, can we please have solar-powered charging poles for our mobile phones? They don't have a home, but they all own a mobile phone. So as a civil servant, you can't think of that. And that's why it is important to talk to these people, to all type of people, and get all the information out from them, but don't be afraid as a government to share your data with the public.
You were talking, John, about disrespecting boundaries. Earlier we heard from Martin Leven, and he was obviously talking about Police Scotland. Police Scotland had a mandate for change. It wasn't a question of shall we change, they were told you have to change. Now then all the question is, how do we change? Does it require legislation to break down those boundaries?
It's a very interesting comparison. I was on a panel with a few months ago with John Carnachan, who was the head of the Violence Reduction Unit and a 40-year serving police officer. and I was talking about all my kind of public service reform agenda and setting out the agenda and trying to get people to agree with it and go along with it and all the rest of it. And after I finished my long, convoluted answer, he said to me, he says, I couldn't live in the world that this guy lives in. He says, you know, I come from a world where if the chief constable says in the morning, we're going this way, we go this way. And if the chief constable decides in the afternoon we go this way, we go that way. So there is an element within the police which is very command and control. You just, you know, if you say it's going to be done this way, they go off and do it. And I can
You're saying that's not the case in councils?
I'm trying to stay on the right side of diplomacy this afternoon, but I think it's slightly more complicated, and more persuasion is required to get all other public bodies who are not accustomed to that command and control model that the police are operating within. Now, so there's and also, to be serious, local authorities are democratically elected bodies. It would be completely inappropriate for me to direct local authorities to do this or do that. What we have done, however, is tried to form an agenda which has been the product of discussion and dialogue with local authorities. So if you actually look at the outcome of the Christie Commission, that, I think, well, you know, if you had the President of the Convention of Scottish Local Authorities sitting here, I think he would say to you that local authorities believe the government's public service reform agenda is one that is broadly endorsed by local government within Scotland. You asked, Mark, about is legislation required, and there's an interesting example of this in relation to the forthcoming legislation on integrating adult health and social care. If that legislation is passed by Parliament, I don't think people who live in West Lothian will notice much difference because of that legislation being passed. Why? Because the Health Board in West Lothian and the local authority in West Lothian are broadly doing today what that legislation will require of the rest of the country. Now that says to me as a legislator, is this legislation actually required if it's possible within the existing framework? Because clearly what there is in West Lothian is a will to do it. And don't underestimate the significance of there being the will to do things compared to the legislative requirement or compulsion to do it. And sometimes you need legislation to drive the pace. In other occasions, there can be a degree of active and willing participation because of the will amongst leadership, amongst middle managers, amongst people in the coalface to actually do it in that fashion.
Joss, would you be happy seeing things go forward on the basis of, well, you know, let the democratic process run its course? Or do you approve of a gentle toe every now and then?
I'm not an expert in Scottish law. You might be surprised to learn. But I do generally think that at the moment, legislation is not what's holding us back. It seems to me that there has to be a real incentive to change. I think the public sector can lack that. The private sector tends to lack it less. But at the moment, we've got some real needs to change. The money is the obvious one. It is going to get tougher and harder. We have massive opportunity through technologies, new technologies, and people expect us to use technologies in new ways to join up services to get better outcomes. There's absolutely something around the demographic time bomb. We want to deliver high-quality public services. That's what we're all in this for, and we know it's getting increasingly difficult to do that because of the demands. And the last one that I think I would say in terms of needs must is transparency. You can't hide anymore. It's very obvious who is doing well and who is not. So I think the transparency agenda, coupled with those three drivers, are probably more powerful than legislative change.
How would you characterise what's been happening in Amsterdam?
As we say, we go out to the public, we go out to the citizens and ask what they want, engage them in all kind of initiatives. And if sometimes the legislation has to be adapted, we adapt the legislation, or we interpret the legislation in a wider or more in a broader way. To give you one example, there is we try to connect all the 420,000 households in Amsterdam to fibre to the home. In the past, for every street, you have to get a separate permit. Now there's one permit for the whole city. So every time somebody's digging there, they can do it under one permit. There was one consequence. They have to inform the electricity company and the sewage and the water company so that only the street can go open once every 5 years. So that's a practical example.
Sorry, I'm from Aberdeenshire. I would love to see that happen. They just seem to be able to close roads willy-nilly up my way, and no control whatsoever. Thank you very much for that. I'm going to draw it to a close there. Can I just ask you to thank our speakers one more time, please?